The rotator cuff is a group of 4 muscles and their tendons that stabilize and control movement in the shoulder joint. These muscles include the supraspinatus, infraspinatus, teres minor, and subscapularis. As we age, the rotator cuff can undergo various changes, leading to degeneration or injury. Some of the factors contributing to rotator cuff aging include wear and tear. Over time, daily activities can cause wear and tear on the rotator cuff tendons, resulting in fraying or degeneration. This process can be accelerated by repetitive overhead movements, such as those performed by athletes or manual laborers. Decreased blood supply. Blood flow to the rotator cuff tendons can decrease with age, making it more difficult for the tendons to repair themselves after an injury. This can lead to a slower healing process and an increased risk of chronic injuries. Bone spurs. The development of bone spurs, or osteophytes, can occur with age. These bony growths can impinge on the rotator cuff tendons, causing pain and limiting shoulder movement. Loss of muscle mass and strength. Sarcopenia, or the age-related loss of muscle mass and strength, can affect the rotator cuff muscles, making them weaker and less able to stabilize the shoulder joint. This can lead to an increased risk of injury. Changes in collagen structure. As we age, the collagen fibers in our tendons can become less organized and more susceptible to injury. This can result in a decreased ability for the tendons to withstand stress and an increased risk of tears. To maintain a healthy rotator cuff as you age, it's important to engage in regular shoulder strengthening exercises, maintain good posture, and avoid excessive overhead activities that could lead to injury.